Hello out there and welcome to episode 72 of the Nursing Home Abuse Podcast. My name is Rob Schenk.
And I'm Will Smith.
And we are trial lawyers focusing in the areas of nursing home abuse and neglect in the state of Georgia. And we are your co-hosts for this episode. A very special and interesting topic for today. We have a very interesting guest coming to us all the way from Australia for a necessary topic for what we do. Will, who do we have on today?
Well, today's topic is going to be about dementia and Alzheimer's, and we have Kate Swaffer, who is the co-founder, chair, and CEO of the Dementia Alliance International. Kate has been the recipient of many awards for her work in dementia and disability rights, including being named the 2017 South Australia Australian of the Year. Kate is the only Australian to be a full member of the World Dementia Council, a board member of Alzheimer's Disease International, and she is the chair, CEO, and co-founder of the Dementia Alliance International, a global advocacy and support group for people living with dementia. She is also the first person living with a diagnosis of dementia herself to have been invited as the keynote speaker at the World Health Organization at the first ministerial conference on dementia in March of 2015, where she demanded human rights, access to the Convention on the Rights of Persons with Disabilities for all people with dementia, and a balance in research between care and cure on the global stage. She is also a retired chef, having run her own hospitality business for 10 years, and before that worked as a nurse in dementia and aged care, and then she operated many theaters on the other side of the world. So we are very happy to have this special guest with us today, Miss Kate Swaffer.
Welcome to the show, Kate.
Thanks for having me.
Now, Kate, as I mentioned before we went to air, a lot of our audience consists of family members, loved ones of residents who are newly diagnosed with Alzheimer's or dementia, and they're going into a skilled nursing facility or nursing home. You being with your background and your experience and your education, can you just from a broad standpoint, what is Alzheimer's? What is dementia? What's the difference between them? What are some of the symptoms?
Well, I think one of the confusions globally is that people differentiate Alzheimer's and dementia as if they're two different diseases. In fact, dementia, the word itself, is simply an umbrella term for a group of diseases known as dementia, of which Alzheimer's disease is one of those types of dementia that comes in under the kind of umbrella term. So it really, the easy way that I find for men to understand it, if I asked you, if you told me you bought a car and I asked you what sort of car, you might tell me a Mercedes-Benz or I don't know what the cars are in America. We'll stick with Mercedes. I'm sure you've got them in America.
Absolutely,
yeah.
I would then say, what type of Mercedes-Benz? And, for women, so to make it easy for women who maybe not be so interested in cars, if someone asked me to go shopping for some fruit for them, I would ask them what sort of fruit. They may say apples. I would then say, well, what sort of apples do you like? So dementia is the umbrella term. Alzheimer's disease makes up somewhere between 50 to 70% of all types of dementias. Then there's another group of dementias in the frontotemporal dementia range. But Alzheimer's is the most common type of dementia. And even then, there are subcategories and different types of Alzheimer's disease. The second highest leading cause of dementia is vascular dementia. And then I think Lewy body is the third highest type of dementia. But it's a collective, it's not a specific disease, it's a group of symptoms that can affect memory, it can affect thinking and social abilities. But it has to affect those abilities enough to get in the day, to interfere with daily functioning, or if you're younger like I was when I was diagnosed, to actually interfere with your working life. It can involve sensory changes. People lose their spatial awareness, their visual depth perception, sense of smell, sense of taste. So there's a lot more symptoms than just memory loss involved in dementia.
And what type of dementia? You said more than just memory loss, and then
spatial awareness, you said?
There's many symptoms with dementia. So particularly the sort of more general type of dementia, the kind of more basic Alzheimer's, where you have short-term memory loss but still have pretty good long-term memory. That is likely to be one of the most common features of Alzheimer's disease. But some of the frontotemporal dementias, it may have a behavioural variant where it does affect your personality and your behaviour, or you may have a semantic variant, which is basically commonly known as primary progressive aphasia. So it affects your ability to speak, your ability to understand words, to comprehend, to ultimately to read. It can cause dyslexia. So the whole range of disabilities that dementia can cause. But the general community seems to think it's just memory loss, but it is so much more than memory loss.
Is there any... when an individual is less symptomatic for dementia, whatever type, are there things at this point in time that could be done in terms of maybe mental exercises or medicines that reduce the likelihood of the symptoms or the onset of
lifestyle changes, anything like that? Is there do we know of anything that we can do at this stage?
Well, in the earliest stage, if someone's lucky enough to be formally diagnosed in the early stage of dementia, one of the things that I campaign for globally is that the symptoms of dementia need to be seen and managed as acquired disabilities. So in the same way as if I'd had a stroke at the age of 49, I probably would have had some cognitive disabilities afterwards. I would have been given rehabilitation and speech pathology and possibly a whole range of other rehab and disability support. People in the early stages of dementia, and if you get to spend some time on Google and actually read blogs and books written by people with dementia, you'll find that their functional capacity seems normal, but they're working hard behind the scenes to manage to function. So to treat the symptoms of dementia as disabilities and then set up strategies to support them. But in terms of medication to slow down or to prevent dementia, currently, to my knowledge, there are no cures for any types of dementia yet on the horizon. There's been a goal with the World Dementia Council that we'll have a cure or a disease-modifying drug at least by 2025. I'm not overly optimistic about that. What I am optimistic about is the research that's being done to either prevent the risk, mitigate the risk of getting dementia in the first place, or to slow down the progression once somebody has been diagnosed. And the research in that area is very strong on lifestyle changes in the same way that the evidence is very clear, for example, heart disease, lose weight, get fit, change your diet, get rid of, large amounts of sugar, reduce alcohol or other drug intake, certainly give up smoking. Those types of things are huge risk factors for dementia.
And those are dementia risk factors. I thought you meant those are the heart disease risk factors. So it's almost hand in hand with just general overall health.
Almost hand in hand with overall health. And I think that what governments and particularly policymakers now are having to fund our health systems are starting to realise if they don't focus on risk reduction to reduce the incidence of dementia, then we're just not going to be able to afford to treat people with dementia. So the current number of people estimated to be living with dementia globally at the moment is 50 million people. That's expected to rise significantly by 2050 if we don't, make some major changes. So, yes, those same lifestyle changes we need to make for heart disease, or, for example, if you are suspected as having diabetes, to take on all the same lifestyle and good health modifications to try and prevent getting dementia in the first place. But dementia is a terminal, progressive and chronic illness, and there is still no cure, and we still don't have any disease-modifying drugs. So, for example, with diabetes, we have a disease-modifying drug. People given insulin. And for heart disease, there are disease-modifying drugs. We don't have any disease-modifying drugs yet for dementia.
So other than the lifestyle changes that you mentioned, such as going on a healthy diet that's reduced sugar intake, possibly exercise, this type of thing, are there any other lifestyle changes in terms of maybe like turn the TV off or get off your phone, these type of things? What other things could be done?
There's a couple of other things that the evidence is showing fairly good evidence for increasing isolation. So social isolation is a risk factor for dementia. And so for people to remain actively engaged and socialised in their communities can, one, reduce the risk, and number two, can slow down the progression of dementia. The other thing that evidence is starting to talk about is new learning is really important. So not so much just a brainy app on your phone, but actual new learning. So like learning an instrument, learning a new language, learning to sing, learning where you're pushed to keep learning. So, if I went to start to learn the piano next week, once I mastered the first three pieces, I wouldn't stay playing those three pieces of music on the piano. I would then go to a harder piece, and then I would keep learning new and more difficult pieces of music on the piano. So new learning is becoming, in the evidence, quite important as well.
So I guess this is a good segue then. So with for those that have loved ones that are going into a nursing home that are symptomatic or becoming more symptomatic for dementia, what are some things that you would suggest to that family member to do in order to enrich the life of that resident that's suffering from dementia?
Well, I guess there's a couple of things to mention just here. Is number one, dementia is not a normal part of aging, and even at the age of 85 years old, less than 50% of people will have dementia. There are about 100 other conditions that can cause cognitive changes, including memory loss. So we need to make sure that our family members don't have some other medical conditions, such as delirium, such as a urinary tract infection, such as a thyroid condition. Those are the types of things that can actually cause symptoms that make it look like dementia, but in fact can be managed and or cured. So I guess for someone who's needing to be in assisted living, my recommendation here, and I've been doing some work in regional Victoria in Australia, is that when a resident is newly admitted to a nursing home, that the family or friends in the community take the person back out to do the normal things they were doing before. So someone might play bowls, or they might go to a bridge club, or they might go, sailing or fishing. But to keep going outside of the nursing home for as long as possible, doing activities that are external to a nursing home. Because once you get into a nursing home, often it's very institutionalised living. It does often equate to fairly poor care. The activities are often quite meaningless and are not in any way, shape or form anything that I would call new learning. And people tend to deteriorate really quickly in a nursing home.
It's interesting that you say that it's not a normal part of aging, because here in America, especially, and maybe only in the South, Alzheimer's is actually pronounced, and this always drove me crazy working in the healthcare industry, but Alzheimer's is pronounced old-timers.
I know.
And it's done for a couple, and I don't know if it's done just for this or if this is also just a byproduct of it, but it's come to the point where it's seen as an old person's disease. Like, well, she's just got old timers. This happens to everybody. And the reality is it doesn't happen to everybody. And another reality is just because you're diagnosed with it doesn't mean that you go straight away to a nursing home or assisted living facility, right?
No, absolutely not. If you're diagnosed in the early stages of a clinical dementia, it's very unlikely that you would, go straight to a nursing home. You wouldn't need to. And I think the organisation that I'm one of the co-founders of, Dementia Alliance International, have a very large cohort of members who have younger onset dementia, who often didn't start out with memory loss as a salient symptom of their dementia. They are actively living positive and productive lives, particularly in the earlier and mid stages of dementia. So it's definitely not an old person's disease specifically. I can't remember the statistics in America. I think you've got 5 million people currently diagnosed with dementia. In Australia, we've got roughly 440,000 people diagnosed with dementia, of which about 26,500 people under the age of 65 have younger onset dementia. So it's definitely not exclusively an older person's disease, but it is more common in older people. But it's not a normal part of aging. So just as our eyesight starts to change and our skin starts to change as we age, so does our memory, and so does our speed of thinking. So there are some cognitive changes in psychology. It's just known as benign senescent memory loss, and that's a normal part of aging. It's when it starts to affect your everyday functioning. So, for example, you might walk into the next room and wonder what you went there for, but in 3 or 4 minutes' time you've remembered what you've gone there for. Or you might put your keys in a place where you forgot for a little while, but then you find them. It's when you look at a set of keys and don't know what to do with them, or you can't remember how to drive the car, or you start to get lost perhaps in a familiar surrounding, or you suddenly can't. I was diagnosed with dementia at the age of 49, and my first symptom was an acquired dyslexia, which I didn't have as a child. Suddenly I couldn't spell simple words like that, and I was seeing 2-syllable words as 2 separate words. And I'd actually worked in dementia. I had no idea that would be a symptom of dementia, and I'd end up being diagnosed with younger onset dementia.
And Kate, that's an interesting story in itself. How do you, on a daily basis, how do you overcome some of these obstacles that you've had to face?
Well, I was a little bit lucky, if you like. I didn't go to university when I was young for various reasons, and I happened to be a university student at the time that I was diagnosed, which was I was 49, but when I started being tested, I was about 46 or 7. Whilst the healthcare sector told me to give up work, to give up my university studies, and to get my end-of-life affairs in order, and to start thinking about an aged care facility sooner rather than later, the university said to me, well, you're clearly in the very early stages of your dementia. We have a whole disability support building and team full of qualified disability advisors. We can help you continue to study. So I use a lot of strategies to maintain functioning. There's a lot of software now that helps with spelling, and with you can very quickly look up the meaning of words with your online dictionary. I have a lot of laminated help sheets, as what you call soft technology. I use other technology to support me with reminders in my phone, reminders in my calendar. Things like asking you to remind me yesterday that this was on today. It's just a simple, really simple way of supporting me. And I do have some memory issues now. So there are lots of things that I do. One of the things that I've done that probably most people don't do is from an early part of my dementia, in the earlier stages, I also employed a speech pathology because I have what's known as the semantic variant of primary progressive aphasia, which doesn't just affect your ability to understand words and find words, but ultimately to speak. And because I've had a speech pathologist on board for 8 years, I have a lot of techniques that have helped me maintain speaking. Now, when I get very tired, my primary progressive aphasia actually kicks in quite badly, and I do have some times when I can't talk at all. I just can't get the words out. But for me, it's very early in the day, so my speech is currently still very good.
Well, Kate, you're certainly very inspirational, and I think that your story is an inspiration to a lot of the families that listen to our podcast, because it shows that just because you get this diagnosis doesn't mean that you can't continue to live a very productive and independent life.
Well, yeah, I often say, don't let the diagnosis be the death sentence. Keep living after dementia and demand. I tell members of Dementia Alliance International to demand support for their disabilities so that they can stay functional. And younger people should be demanding support to stay at work if that's their choice, for as long as they're capable of them. I'm not saying that any of the strategies or even the lifestyle changes that I've made, including exercise and diet changes, and I've continued to stay on at university, which is clearly new learning. They may not be a cure, but they've certainly slowed down the progression and allowed me to manage to keep living a positive life. And too often people take the advice of their healthcare professionals and they go home and get ready to die, and that's incredibly depressing.
Well, can you tell us more about the Dementia Alliance International? We're going to put a image of the website and the location of the website for our viewers to see, but can you tell us more about it?
Okay, so Dementia Alliance International started out, it's really as a grassroots movement. There were 8 people with dementia who... I guess when you're first diagnosed with dementia, people stop talking to you and start talking to either your husband or your wife or the other person in the room, if you happen to be lucky enough to have someone with you. You suddenly start being treated as if you're not a real person anymore and you can't hear. And because of the internet and because of attending conferences, I met a group of people with dementia from different countries, and we talked about setting up an organisation for people with dementia that's run by people with dementia so that we could have our own voice, because you do get sick of being talked over and about. We borrowed from the disability community the "nothing about us without us" motto. And so 8 people with dementia in 2013 worked hard, and on the 1st of January set up was really initially just a website. We set up a website and started advocating for members to join our group. So we had 8 people with dementia from 4 different countries. 2 of our founding members have now died, but interestingly not from dementia, from other diseases, one from cancer and one from another illness. Our membership is free. We run online support groups for people with dementia all around the world in lots of different time zones. We have a monthly educational webinar with very eminent speakers. We've got a professor presenting next week on how to increase your cognitive reserve, and speaking to that topic from a very academic perspective. So there are ways to maintain or to increase your cognitive reserve. Obviously, for people already diagnosed with dementia, that's a very interesting topic. We now have members that are from 44 countries around the world. Our youngest member is an 18-year-old lad from Kenya, and our oldest members are 93 and do live in a nursing home, but they're so lonely and bored in their nursing home, they come to our online group, the company.
Oh, that's amazing.
So it's been a very interesting kind of grassroots movement. I think in my early days as an advocate, I sometimes felt like Rosa Parks, daring to sit on the white person's part of the bus, but there's now so many of us speaking up publicly. You've a lot of dementia advocates in America. There's a lot in the UK, there's a lot in Europe now. I've been doing work in my role as a board member and mentor for Southeast Asia. I have been helping those countries like Singapore and Taiwan to engage with people with dementia to get them to have a voice in their own countries.
Well, fantastic, Kate. You're doing fantastic work, and we appreciate the work that you do. We appreciate you, and we appreciate the fact that you could take some time and come on and educate our audience.
And us as well.
Yeah.
About this issue and the work that you do with Dementia Alliance International.
One of the things that happened last year is the World Health Organization launched a global action plan for dementia, which does include human rights. So for anyone who's listening to this, either with dementia or supporting someone with dementia, it's definitely worth looking up the human rights publication that we have on our website, Human Rights of People Living with Dementia, From Rhetoric to Reality. If anyone who's working in government or policy, healthcare policy, is listening, then I do recommend they read the World Health Organization's publication on dementia, because our national dementia strategies or national dementia action plans do need to start including human rights and access to the Convention on the Rights of Persons with Disabilities in the same way any other person with an acquired disability would expect.
Absolutely, Kate. Well, we want to thank you again for coming on. You're doing great work, and we look forward to what you're going to accomplish in the future.
Fantastic. Thank you so much for having me on your program.
Thanks, Kate.
All right.
Okay.
Bye-bye.
Bye now. Thank you. Bye.
Well, that's very inspirational.
That was a very inspirational story about what she's gone through, what she continues to do, and her work.
Amazing.
Yeah.
Some of the concept, just if you have a loved one in a nursing home, if it's possible. I mean, there's a lot of things that people do. Like I bring her, she likes 7-Up or Mellow Yellow or whatever it is. But I mean, if at all possible, I mean, when you're socially isolated, it worsens those symptoms. So like the more that you could bring family, the more that you can take them out of that nursing home is better. Because in the new learning, that was that I didn't realize that it's not just like doing Sudoku all day.
Yeah, it's
learning a new skill.
Yeah,
that's something that's helpful. But we're social creatures; we want to be around people, and that's
it
so
engages
important.
The brain. Yeah, it's important.
Well, all right. I guess that's about does it for today. We really appreciate you sticking around. If you enjoyed this episode, we have plenty of them. We actually have 71 other episodes that you can check out. You can download them on Stitcher, iTunes, Spotify, or any other location that you get your podcast from, or you can watch each and every single episode on our website, which is nursinghomeabusepodcast.com, or at our website. No, that was the website. Or on our YouTube channel. That would be the other means in which you could watch the episodes. We thank you again, and with that, we will see you next time.
See you next time.
Thanks for tuning in to the Nursing Home Abuse Podcast. Please be sure to subscribe to this podcast on iTunes or Stitcher, and feel free to leave us some feedback. And for more information about the topics discussed in this episode, check out the show website, nursinghomeabusepodcast.com. That's nursinghomeabusepodcast.com. See you next time.